In 2003 or 4, one of my medical school professors, who I hold in high regard, decided to try to help us understand why so many people have this plantar heel pain. Get up out of bed in the morning, can't walk for a while, and it goes on and on and on. And oftentimes it's not benefited by the anti-inflammatory protocols that we've thrown at it, the anti-inflammatory medicines, the cortisones, and so forth. So Dr. Lamont did a brilliant thing, and I'm surprised that it wasn't done prior to 2003. He decided to biopsy some of this tissue. So instead of just having the patient sitting in the exam table, push on the spot, okay, you've got plantar fasciitis, you've got an inflamed heel. He has a background in dermatopathology. So he had a mindset of trying to figure out what kind of inflammation this is and perhaps helping us to come up with a better protocol. And as his paper indicates, which is on our website for any of the audience members that might want to wonder why we're no longer calling this plantar fasciitis, what Dr. Lamont found in all 50 of the patients that he studied was not inflammatory tissue, as degenerative dead tissue, fasciosis. So back 14 years ago, he reasoned that we should no longer call this fasciitis, but we should be calling this fasciosis. And a smattering of our profession has latched onto that new term, or they might be calling it plantar fasciopathy. But overwhelmingly, a lot of clinicians still call it plantar fasciitis. And I ask them, why are you calling it an outdated term? We know better information about this. And some of the responses that I get are the public is familiar with the term fasciitis. And I'm an educator like you. And so if there's an imprecise term, or I don't want to use an imprecise term. I want to be as precise. And not just that, Melissa, if people can understand how young people could get dead tissue in their heel, it starts reworking the conversation from, oh, you're overusing it, your biomechanics are wrong, to maybe you're not getting enough blood flow into the plantar heel. And oftentimes I'll have a patient in the treatment room and I'll explain to them, you have a dead piece of tissue and that's what hurts. And that's why first thing out of bed in the morning, you need to get some blood to that area before it'll warm up and start to feel better. They're a little bit confused because typically in their mindset, it's only the diabetic people, it's only the smokers that get bad circulation. So they don't inherently have bad circulation, but when they take their big toe from the position that it's intended to be, which is something we should let your audience members know, because oftentimes this is brand new information for adult Americans.